As we continue our celebration of Black History Month, we introduce you to a physician whose mission is far more than the world of medicine. She wants not just good health for her patients, but for equity as well. Her name is Dr. Monica Peek, and we are pleased Dr. Peek is joining us live this morning. Thank you so much for your time, Doc.
Thank you so much for having me.
So, one thing interesting I was reading about kind of in your CV and your mission statement is, you kind of touch on how so many non-medical factors, if you will, although mental health is medical, blah, it's all kind of medical, but diagnostician can't get an x-ray and fix it. How many factors factor into our health?
Yes.
Which I think is critically and not a way we typically think. Can you expound on that for me?
Absolutely. We have determined, sort of estimated, that only 20% of our health is determined by medical care.
Wow.
And the rest is determined by the environments in which we live, the health behaviors and choices that are sort of constrained by those environments, and many other factors. And so if we think about a person who may be living next to a toxic waste dump, or a person who's living in, a neighborhood with clean air and lots of green space and a fitness center right next door, the kinds of health opportunities that they have are vastly different. We know that, particularly in this country, that our insurance is tied primarily to employment. So if you're someone who doesn't have a job, you're much more likely to not have health insurance. Now, if you are really, really struggling, you may qualify for Medicaid, but there's still that sort of gap, which has only recently been filled with the Affordable Care Act opportunities.
Right.
But for most of the time, people would be uninsured. And so
Right.
there's just many, many ways in which the actual care of medical delivery is only a part of the issues that people have.
Right, so much socioeconomics at play, and there are still big holes with the Affordable Care Act, although it's filled some of the holes. What made little Dr. Pete, before you were Dr. Peek, become so thoughtful, so not only medically inclined, but with a bedside manner, with an empathy beyond that? Where was that born?
I would say that it started in my household. They're my parents. So my father was a Black history professor. My mother grew up during the Jim Crow era in the South. And she was actually asked to be the first one to integrate the University of Florida.
Wow.
And so both of them grew up in a time of really struggling for civil rights. So they weren't born with all of their rights. They had to fight for them. And so it was their children, me and my sister and my brother. We were the first ones who were born with all of our rights. And so the understanding that these things are not taken for granted, that where I am is a result of not just my parents, but entire generations of people who've been fighting for people, for my generation, and that I have a responsibility for future generations to keep pushing for equity and social justice, not just for people who look like me, but for any population that is struggling.
Yeah, and you have a message about that. Dr. Pete, watch the full story on her, done by my dear friend, Dorothy Tucker. Excellent piece, excellent work you are doing. Thank you for doing that. We've run out of time, had a couple more questions for you, but that's what happens with good conversation. Dr. Peek, thank you, good morning, and keep up the good work.
Thank you so much.